We have a full slate of presentations. We are going to ask the presenters to stick to your high-level talk points so that we can get to the Q&A, which is what I am assuming is most veterans are here for. For the veterans that are in the room, you'll see that we have resource tables lined up. If you have questions where you need to share personal health information, we ask the staff to provide warm handoffs with full contact so the veteran can connect with you directly rather than sharing their personal information here in this forum. I want to thank you again for attending. We're going to go through a couple of housekeeping rules for the town hall, and we're at just under a minute. So, real quick. I'm going to reintroduce myself, Chanel Cook, Chief of Communications. Our team is the one that makes sure this gets on the internet, social media, so that you all can reference it later. We host 4 quarterly meetings a year. Yes, they are on Fridays because that is when we have the most available parking on campus so that veterans can park preferably with ease of access. I want to remind you to please discontinue any sidebar conversations because we are live. It's 2 o'clock. And then in addition to that, please do not share any personal health information during the Q&A. Please try to keep your questions tailored so that, generally speaking, none of your personal health information would be disclosed on the internet because this forum will live online. As you can see, based on the screen, we've got a full agenda. I want to reiterate for our presenters, please do not read your slides. Please share your high-level key points so that we can move on to the Q&A, which is what our director, Mr. Menser, has requested because there are a lot of veterans in the room. Lastly, I want to note coming up in a few months, Mr. Menser's anniversary. He came here in June of 2024, so almost a full year here at Team Atlanta, and under his watch, a lot of process improvements and innovations have come to the forefront, and Atlanta is doing some really good things. So without further ado, Mr. Menser.
Thanks, Ms. Cook. All right, good afternoon, everyone. A much bigger crowd than our December town hall that we had last quarter. I think we had about 5 folks in the room, maybe total. And so I appreciate having you veterans in the room. So my name's Kai. If we haven't met, if you haven't seen my face in one of the email messages, I'm an Army veteran. Did a year in Afghanistan and a year in South Korea. I was stationed at Fort Drum when I finally said, this is nuts, I'm getting out, and decided to go back to school, get a degree, and then I started as a housekeeper. I started as a housekeeper in a private hospital in Tucson, Arizona, and one of my fellow veterans in the service said, why don't you go work at the VA? And I didn't know anything about the VA, a lot like patients, a lot like our veterans. They don't know anything about the VA until you walk through the doors, and then you start to learn. And so one of the things that I want to start doing at the town halls is teaching a little bit. I was out doing rounds last week at one of our clinics north of here, and as I walked around, I met an eye doctor. And I didn't know this. I've been getting care in the VA since 2007, and I just learned last week that I get an annual eye exam. And I didn't know that. Yeah, I know. It's kind of funny, but also kind of scary, because I run this hospital. And so to learn these different things, how do I help get that education information out to the patients? So today we're going to talk about some of those things. There's a lot of positive things on here. I'm going to focus on the most important because I know there's a lot of people in the room and I want to get to questions. Podiatry care. We have a lot of patients that get podiatry care, and we in Atlanta about a year ago started a pilot program for our podiatry veterans where we now go out to their homes and provide care. So there's a lot of patients that can't leave their houses. So we piloted that program here in Atlanta and now are being nationally recognized, and other VAs are trying to do the same thing. So back to the eyeglass conversation and the exam that I can get every year now. Now services for our veterans exist where we can provide that. And I know, right, we send out messages on email, we send out messages on Facebook, we try to do everything we can, but we have 160,000 patients, and it's damn near impossible to get every message out to everyone. I get the emails too, and sometimes I just delete them because I've got other things to focus on and worry about, like keeping my job right now. And so when I'm looking at these different things, there's a lens that I have, but we're trying to communicate as much as we can about these. All right, so 4 bullet points. We were told earlier this week that the Secretary of the VA might come visit us. And I said, all right, I need to start thinking about what I can tell him as he's working as our most senior leader. And one of them was that we have excellent outreach programs here in this VA. Every single week, we are doing something to outreach to our patients. Every single week. And part of that success is that we are growing. In the last 4 years, we have grown by almost 1,000 patients a month. And that's important because we're sending more patients to the community than we ever have. Because we can't, right, veterans know this, we can't build a building as fast as we are growing in the federal government. That's true. Very true. The second thing is when you look at the top 10, like you think about there's 140 VA medical centers in the country. You look at the top 10, the Dallases, the Gainesville, Floridas, the Bostons, the pretty much every VA in Texas, Tampa, Orlando. Those are the top 10 facilities in the country by number of staff, okay? If you look at those top 10 facilities, we have the 3rd highest growth in customers with 37,000 additional patients. We're the 5th highest in workload. So we have this fancy way to measure, how much work it takes to take care of each patient. We're right in the middle of that top 10. And guess where we are on the list of the top 10 with the number of staff? The worst. We have the least amount of staff compared to any other medical center in the country with, like I said, right in the middle on the workload and right at the top with the number of patients coming through our doors. So for anybody to say you need staff, I know, okay? And that's important to me because the secretary right now is going through and having conversations, right, in the media about staffing. And so I want him to know, we're one of those sites that have been extremely efficient and effective with our staffing numbers. But at some point, right, we can't win a race by starting 3 days behind everybody. Right? I'm not talking about 3 minutes. I'm talking about 3 days, right? The next thing is our research program is in the top 20 in the nation. And you may say, what's the relevancy of this? Research in the VA is why we have the vaccines we do. Research in the VA is why we provide the care that we do the way we provide it. Take amoxicillin for 10 days versus 65. Take care of yourself. Wake up in the morning, first thing you do, it's because of the research. So we have the top 20 in the nation for that. We're really proud of that. And then the last one on here is about providing additional access for our patients. In Atlanta, we have the most productive telehealth program in the country. Now, I get it on both sides. My patients tell me, hey, Kai, hey, Mr. Menser, I want to come in, I want to be in groups. And you know what? Give me your information. I'll reach out to mental health. They'll make sure you're in a group. I turn the corner in the exact same hallway and a patient says, man, why do I have to come in here for groups? Why can't I just do this at home? And I say, you know what? Give me your information. I'll reach out to mental health. And 100% of the time, mental health takes care of that patient the way they want to be taken care of. But to me, what I'm most proud of is when I get an infection as a veteran, I can go into My Healthy Vet, talk to my nurse, talk to my doctor the same day, do a virtual appointment, get my medicine, although it's typically difficult to get because there's often running out of it somewhere, get my medicine from the VA and still stay at home, okay? That's one of my most proud things. All right, so that's all I've got. I've got a full page, but I'm not gonna go over all of it. I just wanted to share some real high-level stuff with everybody. Thank you for coming here. As a veteran, for the veterans in the room, I brought my service chiefs, my program managers, and my leaders in here to hear what you had to say.
Can I ask one question? What are you saying your job is to do? Basically?
My job is to take care of the staff so they can take care of you.
And if your staff ain't doing their job, then what?
Then it's my job to make sure that the service chiefs and the leadership team are holding those supervisors accountable.
Well, I got that major problem going on constant with me.
So we'll get your information and we'll take care of that. But that's my job. I tell people all the time, I don't take care of patients. One, I'm a housekeeper. You don't want me giving you medicine, right? Two is I have people who've gone to college for years to do that, trained to do that, and your taxpayer money's paying them to do that. So if I'm doing it, I don't need them, and we're all going to be screwed up. Okay? That's why I'm here, is to take care of the staff, to take care of you. All right. I think next in line we have Dr. Sarah R. There he goes. There you go, sir.
Thank you. Wow. Thank you. Thank you. Thank you all. I really appreciate the time. Quick show of hands. How many of you know that we are one of just 14 VA hospitals in the country to have a rehabilitation research center? It's quite a privilege. How many people know that? I have work to do. I have work to do. So it is an extreme honor to have a rehabilitation research center in this hospital, and we are here to serve you. So I am Joe Nocera, and I have the privilege of being the director of the Center for Visual and Neurocognitive Rehabilitation. So as the director of the CVNR, what we are looking to do is improve the health and quality of life of veterans with both brain and eye diseases. So go ahead and go to the next slide. So I'm going to throw out some stats that you probably are all aware of. Unfortunately, we have 67% of all veterans have experienced at least one traumatic brain injury. 67%. We also have at least 17% of all veterans who have experienced PTSD, post-traumatic stress disorder. Now, we have problems that are faced each day when veterans have both TBI or PTSD. But what's even more unfortunate is that these issues result in long-term higher prevalence of neurologic disease, of brain disease, Alzheimer's disease, Parkinson's disease, stroke. So what we're trying to do is identify ways that we can identify biomarkers so we can identify who's at risk and then treat that person earlier in the disease process. If we treat earlier, we can better take care of our veterans. What about vision? So 1 million veterans are experiencing some type of visual disorder. So things like glaucoma, age-related macular degeneration, diabetic retinopathy. Now, interestingly, we evaluate the eyes for eye-specific diseases, but what research in the center, right here in the VA, is showing that we can use the eyes as a window into the brain. And if we can identify individuals that are earlier, that are at risk for neurologic disease, again, Alzheimer's disease, Parkinson's disease, we can hopefully treat earlier, improve quality of life, improve longevity. Next slide, please. So I want to highlight some of the impactful work that's happening in our center. Dr. Michelle Pardue has been doing work with a device that evaluates the eyes, a flash of light in the eye, and the response to that flash of light tells us that those eyes are susceptible to eye disease way earlier than what we're currently using with the current technology with eye imaging is doing. So we're identifying those at risk for eye disease much earlier in the process. Because of that, we can treat earlier, prevent blindness in veterans. Excitingly, Dr. Pardue's work is being patented by the VA, so this work is going to go out and impact thousands of veterans, hopefully more for a long time to come. Also important is that a very similar device that flashes, again, light in the eye, and the response to that is being shown in her early work to be able to identify brain disease, again, Alzheimer's disease, and we need to identify these things earlier prior to symptom onset so we can treat better. Post-traumatic stress disorder, again, 17%. Unfortunately, most veterans that have PTSD do not receive treatment. That is changing with Dr. Sheila Roush's work, who's also in our center right here in the Atlanta VA. Her prolonged exposure therapy has been shown to be effective at treating PTSD, but more importantly, it's scalable. This treatment is now available in every VISN in the country. It's been implemented at over 200 hospitals and clinics. That's thousands of veterans that are being impacted by this treatment that was developed right here at the Atlanta VA. Now, what's equally important, and I want you to remember this, is that PTSD sets veterans up for increased prevalence of these neurologic diseases, Parkinson's disease, Alzheimer's disease. So if we can treat PTSD, we can lower that risk in veterans. Last thing, we also study more traditional rehabilitation approaches like exercise. What we've shown with exercise is that in older veterans that we can improve brain health. We can improve the small vessel health within the brain. We can increase blood flow to the brain, how the neurotransmitters in the brain work. All of these lessen neurologic disease risk, so extremely, extremely important. That's just a small sample of research that we're doing here. That's three examples. We have 20 investigators in our center up on the 12th floor, all doing equally impactful work. I'm happy to discuss that work with all of you at any time. Last thing I want to highlight, we have to train the next generation. So our center is uniquely positioned to train with our high-quality researchers, with the type of work we're doing. We can train the next generation. We have over 200, since 2020, we've had over 200 trainees. These are undergraduate students, graduate students, medical students, PhD students, early career medical students that can come into our center and train again with the purpose of training the next generation so that we can continue to treat and improve the quality of life of veterans. I know my time is short, but I want to thank you all for your time. I want to thank you all for your service. I want to thank the VA OR&D for funding, and I want to thank local hospital leadership, Mr. Menzer, for support, the Office of Research here in Atlanta, the entire team at the CVNR for their hard work and support, and then lastly, of course, all the veterans who have participated in our studies. Please get involved. We have a table over here if you want to hear more. Thank you very much.
Hey, good afternoon, everybody. It's nice to see the large participation. Is there, next slide, please. So I want to talk about motorized wheelchair scooter repair. So this year we implemented a national contract where veterans no longer require a consult from their provider to get a repair. It's a direct phone call from the veteran to the vendor, and then the vendor will schedule an appointment to come out and take care of your needs. So what we have learned is we are tracking the data. The vendor is getting out to our veterans within a week, and we've heard nothing but very good feedback from the veterans and the vendor on the communication between the veteran and the vendor. Sometimes there are some questions about eligibility, but that's a quick phone call from the veteran to us, and from the vendor to us, and we get that resolved relatively quickly. So that's all I've got for folks who would like this handout. I've got some handouts here for folks who would like to talk to me directly about some of your prosthetics concerns. I have my card here, so just I'll go back to the back. Just raise your hand. I can drop some stuff off to you. And then please reach out to me via email, and then we'll start a dialogue. And then if I need to call you, I'll call you, okay? Thank you.
Hello, everyone. My name is Lamisha Edie. I'm one of 2 Compact Act coordinators here at the Atlanta VA. My partner is Whitney Jackson. So we want to tell you today about Compact Act, Comprehensive Prevention, Access to Care, and Treatment Act. The purpose of Compact Act is basically to expand access to suicide emergent care for eligible veterans, enrolled or unenrolled veterans, by covering the cost of treatment. Basically, the goal of this act is to remove the financial barriers for veterans seeking suicide emergent care. The goal is, the impact of this act, we hope that we will be able to decrease suicide occurrences amongst veterans. Next slide. Who's eligible for Compact Care? Veterans having served more than 2 years of active duty, and veterans of the Armed Forces Reserves that have been discharged under conditions other than dishonorable or by court-martial. If a veteran has a humanitarian status, he does not qualify for Compact. However, it can be re-reviewed with eligibility. So what does Compact Act provide for veterans at risk for suicide? If a veteran is determined to need acute suicide emergent care due to suicide emergent care, so let me explain what that means. If a veteran presents to the VA here or a local ER and basically reports to the licensed provider, ER doc, or the behavioral health assessor saying, hey, I'm having thoughts of harming myself, maybe using a gun, or I've attempted to harm myself using a rope. Once the LIP determines that that veteran meets the criteria for suicide emergent care, under Compact Act, the veteran can receive up to 30 days of inpatient care, up to 90 days of outpatient care, and that can be here through the VA or in the community. Also, it's noteworthy to know that under Compact Act, it will also cover associated suicide emergent costs, such as the ambulance ride, medication, as well as transport. I'm sorry, I already said that. Oh, I'm sorry. I want to make sure that it also can cover medical. So if a veteran does have a suicide attempt, if there are any medical complications associated with that, that would also be covered under Compact as well.
Who can report and how to report? Veterans themselves can report, as well as their loved ones. They can call the 1-844-72 724-7842 number. First responders and community providers can also call that number, or they can contact us through the Emergency Care Reporting Portal, which is emergencycarereporting.communitycare.va.gov. If a veteran wants to appeal a decision related to emergent suicidal care, they can contact the Atlanta VA patient advocates at the main number, which is 404-321-6111, extension 202264. They can also appeal through the VA billing inquiries, which is 1-866-258-2772. They can contact Community Care at 1-877-881-7618, or they can contact myself and Miss Edie. And our numbers are actually going to be listed on the next slide. Miss Edie can be reached at 404-931-1381, and I can be reached at 404-859-8559. We also have Compact Act brochures that are on the table with our supervisor, Michelle Lamb. She is the suicide prevention coordinator, suicide prevention manager, and also the Compact Act manager. So we have tons of brochures if anyone needs those, and they also have our phone numbers on them.
This is a big deal. I didn't entirely understand this as a veteran. This is a big deal because if you're a veteran and you're having a mental health challenge and you get care in the community, we'll pay for it. Okay, so, whether it's you sitting in this room or somebody you know, just make sure they call us and let us know. That's the key, is we need to know about it, right, as it's happening so that we can take care of you. All right, so I'm going to turn it over to our chief engineer. Mr. Minley, just make sure you speak into that mic because the folks online are having there you go, thanks.
Good afternoon, everybody. I'm going to speak to you about the capital infrastructure improvements that we're working on. First and foremost, we have finally awarded a new design to build a new bridge. We had the kickoff meeting today, and the design is going to kick off within the next 2 weeks. This is going to allow us to finally get you a brand new bridge. We're going to open up the entrance to Building A, which is our main entrance. And that will improve our ingress and egress throughout the campus, really. Next slide, please. The 5th floor, we've awarded that, and we're actually going for a cost limit increase. The purpose of the 5th floor is to provide a new state-of-the-art behavioral health unit for our patients. Right now, they're being served on the 4th floor. The 4th floor was renovated in 2007, so it's time for an overhaul and an upgrade. So the project will provide new state-of-the-art architectural features and equipment. Next, please. So we're also working on our high-tech, high-cost equipment posture as well. We've got a cath lab equipment that's currently in design and will transition to construction next year. Next, we're currently installing 3 radiography fluoroscopy devices within radiology to improve our imaging equipment infrastructure. The projects are in progress. The first completion is Monday, with the others to follow end of April and June. So that's in progress. Last project is at our Trinka Davis Veterans Village. We're going to be building a 12-bed CLC pod-like, home-like facility. The VA still strives to have the best care anywhere, so we're bringing those services back in as best as we can. So this will be a beautiful expansion to our already beautiful Trinka Davis Veterans Village. So, and this is just a mock-up of what the pod will look like, and that's it. Any questions or concerns or comments from me? All right, thank you.
Thanks, Mr. Minley. All right, coming up is Terrence Richard. He's over our business office and our health administration services, what you see up here. This is a big deal, right? As a patient, when I got here, I heard a number of complaints. We need the kiosks. We want to be able to do our travel on the kiosks, right? And so him and his team were working on it, and we had to work through contracting because we got rid of them, not because we decided to, but because Big VA told us to. So they removed them out of all the VAs in the country. And so Mr. Richard and his team were working on getting them back. We did the engineering presentation because I want you guys to see where your taxpayer money is going to, right? When you walk around, you see things, you're like, wow, man, I can't believe this place looks like this. It was built in the 1950s, I think, right? 1960, sorry. Thank you, sir. Part of the change is the medical equipment to keep us state of the art, right? But we're not funded, right, to build a new hospital and create new medical equipment for everybody, right? So we're focusing on the care as much as we can, all right? And part of it is, as you saw Mr. Minley talking about, access into the building, infrastructure in the building, and those pieces of medical equipment. So I'll turn over to Mr. Richard. Thanks.
All right. Good afternoon, everyone. So just a quick update on the kiosks. We do have new VetLink kiosks that are being deployed throughout the organization currently. We have installed in the majority of our clinics here at the Atlanta VA site to include a bank of kiosks that are up front by our vaccine center that can be used for BTSSS and all the other services that are listed here. We did want to make sure that they were as connective as possible, try to be a little bit more efficient with the service that we are providing you all, so you can put in your request for information if you're trying to get your medical records from us at any of those kiosks, and that request will go to our ROI team to get those records mailed out to you. You can update your demographics, insurance information, and most importantly, you can put in your travel claims at any of those kiosks, and it'll go to our travel team so we can get you taken care of for your transportation expenses. That's a big deal for us. It does help us out, help us be a lot more efficient if you give us your transportation claims electronically. The paper is just, it's just that. It's paper. It's stuff we got to lug around, shuffle from person to person, keep up with. The less we can do that, the more time we can spend making sure that we get your payments to you successfully. That's all I got. Thank y'all.
Good afternoon, everybody. I am Angela Silhammer. I am the Assistant Director next door at the VBA Regional Office, the Isaacson Regional Office next door. Had a couple updates for you this afternoon. First, we have PACT Act updates. So VA, as we talked about all the research you guys are doing here and all the great things, they're constantly looking at conditions, trying to see if we can add more presumptives. And as of January 2nd, we're able to add some bladder cancers to presumptive conditions for those for PACT Act claims. So bladder cancers, I won't read all of them there. They've been added for PACT Act purposes. The other thing is chronic multi-symptom illnesses. That's like leukemias and melanomas and things like that. Those have been added as of January 10th as presumptives for certain people that were exposed to burn pits. So those are two things that are new. Now let me tell you, this stuff changes frequently, right? So I wanted to highlight that web address down there, va.gov/PACT. Anytime there's something new with the PACT Act, if you just check out that website, it'll have the latest information on it. Wanted to talk a little bit about automated decision support. I think if you've been in touch with some of the news articles lately, VA is trying to use automation to try to improve the claims process, specifically the timeliness of how fast a claim is worked, because we all know that can take a while sometimes. So we have a system called Automated Decision Support. And the conditions you see there, the CFI standing for if you have a claim for increase, and the P standing for if it's a presumptive condition. If you file a claim for one of these conditions, and the one that's been most recently added is at the bottom, the ankle. If you file a claim for one of these conditions, it is possible that you might see a decision on that particular contention before you see decisions on, say, other contentions that you filed, because it's going through an automated process. Now, let me say that doesn't mean that a human doesn't ever look at it. What it means is that a rater doesn't have to go through the file and gather all the service treatment records looking for certain conditions. The computer is smart enough to see what has been filed and to go through and pull the records up so that when the rater's looking at it, it's right there in front of them, meaning they have everything they need to make a decision quicker. They don't have to sit there and go through the file, which is a labor-intensive process. So we have 21 other conditions that are either in a pilot or prototype stage right now, and when they're released, they will be in prime time, if you will, like all of these conditions. So again, I want you to, it goes through a lot of quality review processes. I know sometimes we're untrusting of computers. We want people to look at it, but the rater, the person that actually rates the claim, does have a chance to accept the evidence that it's pulled together or not. So there is a human element here, but it makes it a little bit faster for us for timeliness. All right, I wanted to talk a little bit about fraud prevention really quick. I think many of you may know this. I was talking to this gentleman here, and he says he has a VSO, so maybe you guys already know this. But I wanted to highlight that, you know, with us paying so many benefits under the PACT Act, there's a lot of people out there that want to help you, and they may promise you a certain outcome, like, oh, I'll get you 100%, or, you know, oh, I'll get your claim through quick. I just wanted to put that out there to be very cautious of people like that, because they'll charge you and they'll take you to the bank, you know what I mean? So be very careful about that. Do not trust anyone that's not accredited by the VA. If they're accredited by the VA, they've gone through a background check and such as that, and they can actually get into our systems. They can talk to us. We talk to accredited agents and we talk to VSOs all the time. They're very knowledgeable about the claims process. So if you're looking for someone that's not a VSO, make sure they're accredited by VA. That's the thing to watch for. If it's a VSO, which is what this slide is, our VSO partners like Georgia Department of Veterans Services, American Legion, all of them, they're all accredited, right? And you know, you got Georgia Department of Veterans Services in almost every county, and you can easily find someone to help you locally there. They're good. They have access to the systems. We talk to them all the time. I probably talk to GDVS representatives multiple times during the week. So we know them really well, and they'll call and ask about a claim, and we're partnering with them really well. So these are the guys that are really going to help you without a fee. All right, and then VA accredited representatives, which is like attorneys that get accredited, they've been through our background check. However, they may charge you a fee for certain things they do for you. So again, the VSOs will be without charge. Some of these other accredited agents will charge you in certain conditions. And I put the resource down there. If you go to www.va.gov, you go to the bottom of the screen, it has a place for looking up information on accredited representatives that may help you. I think they're going to do questions at the end. Am I correct? Cards on fraud? No, sir, I don't think we have a card on it, but that's a good idea. Might consider that in our public contact area. Might be a good idea. All right, so if you'd like to talk to us in person, we're open 8 to 4. We encourage appointments. We will take walk-ins. You may just have to wait a long time. The other day, the wait was an hour, and I hate that. So we encourage you to call our line there, get an appointment, and we can see you faster if you walk in. And we also have a virtual monthly claims clinic every month from 4 to 6. You can call and make an appointment and talk to someone that's actually someone that actually works claims to kind of look at your claim and talk it through with you. Our next ones are coming up on April 24th and May 22nd. Again, you just call our number and say, I'd like to make an appointment for your virtual claims clinic. I think that's all I had. Thank you very much.
Hello. You got all the good stuff from them. I'm just the easy guy to go to. I'm just here to give you food and drinks. So a lot of people don't really know the history of the Veterans Canteen Service, so I just made a couple of points here. So our whole job is to have quality products and services at a reasonable price for your convenience and care. So we were established by law back in 1946. General Omar Bradley worked with with Congress to get the law to create the canteen service, and we are a non-appropriated fund service. So we survive based on what you buy. So basically, whenever you come to the store and you're purchasing your food, your products in the cafeteria, coffee shop, that's what pays for the service that we're providing. So we only keep enough to keep us sustainable. Everything else gets put back into programs, or like veterans benefits programs, homeless veterans, move-in kits, things like that. We go out on missions whenever we have hurricanes, earthquakes, natural disasters. We have mobile food trucks that are ready to go out. So we started off a long time ago, very basic, like dime stores, and I don't know if we can go forward. And we've advanced to a more modern culture. We have a farmer's market every Tuesday and Friday, so you can get healthy vegetables and fruits. And it's going to be at the front entrance, the Claremont entrance. They set up every Tuesday and Friday. We also have them coming out to AVC and Fort McPherson. We also participate in a Be Well Whole Health program. We're always trying to find new, healthier things that we can provide and teach our employees to live by, so that we can all live a healthier life. That's all I got. Thank you.
All right, everyone, I'll be brief. I'm already short. Sorry for blocking your view. We have always established that our events will be online. So we urge veterans to take a look at not only our social media, but our official va.gov website. We implore and empower our staff to list items there so that you have knowledge of them, including knowledge of this event. The veteran town halls are usually placed on the website at the end of the previous fiscal year. So that means you'll always know where they are, which is our events page. So I won't read to you, but we have a lot of events that we would like you to participate in. As you know, there is a blood shortage across the nation, so our staff has been diligently working with CDCE to ensure that veterans can give if you feel so inclined. So please take note of that. I'd be remiss if I did not include a gentle plug for the South Cobb Clinic reactivation. I'm not sure if Mr. Bruton is in the room, but he is the site administrator for South Cobb, and they go live on April 1st. So that provides services for mental and behavioral health needs to all of our veterans. I won't read the rest. We do have some folks joining. If you'd come up now, I believe Dr. Green is in the room to discuss VA 2K.
Good afternoon, everybody. Thank you so much. I'm Alton Green, I'm Chief of Occupational Health. What we do is we take care of the employees who take care of you all. But over the last couple of years, next slide, we've noticed that we haven't had a lot of participation in one event, and that's the VA 2K. That's a national event. COVID kind of slowed things down. So in conjunction with Employee Whole Health, we do an event on May 21st from 11 to 1. We want to invite all the veterans to come. Even if you can donate some items, it's for encouraging healthy living and supporting homeless veterans. You can participate in the C-Box. There will be some challenges. We do need you to sign a liability waiver if you do decide to do it. And if it's inclement weather, we'll do it on the ground floor or either outside near Emory University. And these are just some pictures. Again, if you can't make it, we will take donations, pants, t-shirts, socks, underwear, any donations that you can make, that would be great. They will go to CDCE. Next slide. And this is a t-shirt. If you want to get a t-shirt or a hat, you do not have to. For those employees, you don't have to do this as well. But again, we want to make sure we have some veteran participation. In the past, it's been a little bit less, and that may be because we weren't able to get out as much. That's it. Thank you.
So we have 22 sites of care, and here they are. There's a couple of warehouses. I mean, we have the most number of federal leases buildings in the country in the Atlanta VA, and we know that because the president has decided that we're going to return to the office. Right, and so we're doing inventory of every single space in every single area of the country to try and find space for staff to work out of. We have a lot of clinical modalities that are virtual: telehealth, telemental health, teleoptometry, teleradiology, There's a lot of tele stuff out there, and we're even working on possibly trying to get them in the building. Right, so. It's as a veteran, you listen to your leaders and you charge forward with the mission. And so that's what we're doing. So I wanted to put this back up there to really show, how big we are. There's entire regions of the VA that we are bigger than as one medical center. All right, so this is it. This is the question and answer. But before I do that, let me give you guys some guidance. I know there's a camera in here, and then there's the projector, some guidance. So over here, this is where I asked you guys to speak up. Over here we have, at this table in the front left, eligibility, travel, Benny travel and scheduling. Transportation. Okay, so here's why I'm sharing this. Great example. I don't know the answers, right? What did I say? Just like you are. And if I know everybody's answers, then I don't need them. So they said, let me come into the room and let me give you the expertise, because it changes every day also, right? At this purple table back here, we have the Caregiver Support Program. And I can't see Mr. Terrence. Go ahead, sir. And community care. Oh, thank you. We have community care. So, 27% of our patients get care in the community. It's actually the lowest in the region, but it's growing. It was 26% last year. Okay? So if you've got a community care question, comment, concern, right there is our expert. In the back corner, we've got toxic exposure screening. Right? As a patient, I went through this. I got an increased service connection because I did it. I was in Afghanistan. That's an easy one. There's burn pits everywhere, all right? So if you want to have a conversation with them and increase your service connection, speak with them. In the back right-hand side, patient advocates, all right? In the middle section here, I know part of it's My Healthy Vet, Connected Care, My Healthy Vet, and Suicide Prevention Compact Act. Thank you for coming up there. And in the front right-hand corner, we have the Center for Visual and Neurocognitive Rehabilitation and Women's Health. All right, for our women veterans. We have the largest women veteran population. All right, let's hear some questions. So here's what I'm going to do. You're the first hand I saw. Here's what I'm going to do. I'm going to hold the mic so people can hear it. I'm not going to give it to you because last time I gave it to veterans and they talked for about 20 minutes. Right? So, okay. All right, and then I want you to have the questions so that we can make sure folks online can hear it. All right? Okay. Go ahead, sir.
I'm a Vietnam veteran. I'm 74 years old. I've had 7 surgeries and 13 procedures here at VA. And my care, I've had good care here.
You better have. You come back for 7 surgeries, you better have.
My problem here is I'm a mental health patient.
Okay.
And we had the mental health on the 3rd floor.
Yes.
And so our peer support person retired.
Okay.
So most of the guys in our group were Vietnam veterans. And we haven't been able to get any support since our peer support person retired, February last year. Mr. Bates has been good enough to let us meet at Arcadia for a room, but we don't get travel pay. We just meeting. And they have people from Loganville, LaGrange, Decatur, Georgia, coming in.
All right. Let me see what we can do.
But what my thing is, when we was told that a new peer support person would be hired this month.
Okay, here's why I'm laughing, right? Here's what I'll tell you. We can't hire right now.
Yeah, what they told us.
Okay. I really apologize for that. I'm genuinely sorry. Right now, we are hiring very, very slowly.
This person is already hired, sir.
I know. I've got 200 of those.
Wow. Okay.
200 and then some. Okay, here's what happened. The freeze, right? So we stopped hiring everybody. And a lot of folks are like, well, I can't just wait around. I'm going to go get another job, right? A lot of folks said, okay, I'll wait around, right? And then it was, well, here's 26 exempted professions that you can hire for, okay? Which there's 500 professions in the healthcare system. So we were given 26. And I don't know if it was or wasn't one of them. But then we were told, okay, you can hire those folks, but the systems shut down. So all the electronic systems shut down for us to have the capacity to move through the recruitment process. I don't know why I'm not educated enough to figure that out. It's way above my pay grade. So we started working on paper, right? And this is weeks of time. And then at the same time, right, probationary employees are being terminated, right, without us truly having that complete understanding. And then we're bringing those probationary employees back, and then the exempted list grows, but guess what hasn't changed? The electronic systems for us to have the ability to hire. So I can call you up on paper, but there is fingerprinting and background checks that must be done electronically, right? That we're struggling with trying to figure out how do we, and this is across the nation for us right now. So our last new employee orientation class was last week, and we had 0 people come on board. Last year, we averaged 35 people every 2 weeks. So we are aggressively, as the number of people in this room are all on the same page with this, trying to hire as many people as we can. But that's an excuse. we still need to be able to provide you the care that you're asking for. It may take us longer, or we may have to send you to the community, but we still need to be able to get back to you. Okay? So let us take your information and we'll get back to you on that one. Okay? All right? I think, yeah, there. I saw this hand, and then I saw this gentleman with Celine.
I just got a question. Which table is VBA?
Benefits. We have Miss Angela Sealhammer here to help support that one. Yes, sir. Yes, sir. There you go. Thank you. And then I saw Celine. I'm trying to remember the hands. Go ahead, sir.
Okay, my question is, I was in an accident, and I went to Grady, and I showed him that I was a veteran, and he refused to send the bill to the VA. And I called the number that the VA had, and the number didn't work. So I'm stuck with a bill, and I emailed you all, and I didn't get any help. So how can I resolve this issue? They paid the ambulance bill, but now I have a $12,000 bill.
Right here. This table right here is going to help you. It's not uncommon. Yeah, it's not uncommon, okay? We'll help you. Go ahead, sir. Excuse me.
First of all, Director, I appreciate everything you did. Last time we talked at the town hall, I appreciate it. Some things got done, and we really appreciate that. The in-person group, I understood what you said, but we still need in-person group.
I agree.
Because we have veterans that wanted to commit suicide, but the other veterans talked them out of it. But we need some help in that respect.
I agree.
One other thing, and maybe you can explain it to me. And we talked about that last time. You said you're going to look into it. Friday meetings, when we have town hall. Why Friday? It's hard to get through traffic on Friday for the veterans. We take all day to try to get back home. Okay, Saturday was the best thing that was happening. Saturday.
All right.
So if you can still look into that, I appreciate it.
We did look into it, and the team said there's less attendance on a Saturday, but here's what we're going to do. We're going to test it. And we'll do a Saturday quarterly meeting. That's a great idea. I mean, you'd seem, yeah, I remember last.
One other thing, caregiver and community care.
Yeah.
Man, those are the best thing you all got going here.
Our caregiver support team?
Yeah.
Oh, yeah, I agree. Yeah, huge, tremendously satisfying. Yes, sir. Thank you. And we'll do that Saturday event. You bet. This is the kind of activity we need it's constructive, it's beneficial, and it's, we can't fix everything, but we can work towards fixing everything. So thank you.
Trying to ask you just one question.
No, but these guys raised their hands real tall, so I just.
Oh, I'm sorry.
This is your third question, though.
Not really. Not that I know of.
Go ahead.
How did someone get in touch with you?
That is a $1 million question. Everybody can get in touch with me. Here's the challenge.
I'm listening.
There's 161,000 patients. And I meet with patients once my team has attempted to resolve the issues. And if the issues continue to elevate and can't be resolved, 99.9% of the time I find myself in front of that patient. Sometimes the patient is, there you go. Okay, so then I'll meet with you. Yeah, I'll meet with you.
So where do I meet at?
Right here. Yeah, go ahead, in the back.
Yes, I just wanted to say I'm very appreciative for transportation. My ability to drive ended suddenly, ironically behind the wheel of a car. However, getting through the transportation is an issue. You'll call, it'll ring, and then you get caught in a cycle, never get a hold of anybody.
Okay.
Even when you go in person, there's a problem.
Okay.
I've actually come in here just for that, and things still went sideways.
Okay.
So a callback line and an email something that's actually monitored, an alternative way of communicating with transportation would be helpful. Because when we miss the community care appointments that are made for us, which I have more problems out of community care appointments than I do VA appointments. When we miss those appointments, then y'all don't want to send us out to community care. And one of the biggest problems with being in a wheelchair is that my every move is contingent upon somebody else. I can't give you my word. You say, Alicia, you're going to be here on Thursday too? And I go, sure, I will.
Yeah.
And then transportation tells them, yeah, we got you.
We can work on that. Well, we can definitely have our transportation team look at a better system to manage those callbacks for you. Yeah. I see a hand up here, ma'am, in the pink.
I have a proposal.
Oh, okay. She got it written. There you go.
Yes, sir. My concern is about, my biggest concern is about the rideshare program. One of the things about the rideshare program, my PCP has filled out the authorization for me to use the rideshare program. And basically, I have issues where I cannot drive. One of them is sleep apnea. I'm very drowsy during the day, and I cannot drive. My care clinic is Pike County. I live in Clayton County. So in Pike County, they no longer go out to Pike County. So I'm like, wow, geez, how do I get to my appointment? So that means I have to drive. So what is my alternative to get out to Pike County? Does that mean they do not care if I drive?
No, we care. And I'm going to take the mic away. We do care. If anybody says we don't care, then you're not here for the right reasons. We come to work every single day and try to make it better for our patients. Of course, there's issues and challenges with our patients. Of course, there's issues and challenges with my staff, right? We are human beings, but we do care. Here's what we can tell you. I cannot provide a taxi to every single place in Georgia. Why? Because you don't pay enough taxes for me to do that. We cannot afford to do that. We can look into it and make sure, right, that either we have a volunteer, which we have less and less volunteers, to drive out to the clinics and do this for us. We, as we just talked about with staffing levels, we are not funded to provide a shuttle from every clinic to everywhere, right? And so what probably happened was somebody either was terminated, not because of me. We couldn't fill the position, again, not because of me, right? But those are excuses and things we're going to have to deal with. Maybe we have to send you to the community, right? Which, again, I do not know, not as the expert, if I can transport you to the community either, right? What I'm seeking is your awareness and knowledge to the challenges we're all facing. Not because of the decisions you made, and not because of the decisions I made, but because of where we're at. What I can promise you is a response, though, okay? I promise you a response. There's two people from travel, one sitting right here, right? Right here. She can follow up on your exact specific issue, and I'll follow up with her and find out what exactly that was. Go ahead, sir.
This is the first time I've come to this meeting. I'm a veteran myself, 23 years. How often do y'all have these meetings?
Every quarter, we meet with the veterans. Typically, we do it in the auditorium. The challenge with the auditorium is I can't do this. It's like a movie theater.
Okay.
And we had it last December, and like 4 or 5 people in the room said, you know, y'all need to do a better job of getting the information out. And we tried over and over to get it out as much as possible with my communications team.
Okay, one other thing. I'm sure a lot of people have heard of this. I've spoken with a lot of people from a lot of different a lot of different other states. Okay. And they say when they come here, they move here from wherever. They say this VA here in Atlanta is the worst they've ever seen.
So So I've got someone over here saying go to another VA, and here's what I'll tell you. One is I received part of that, all right? But I received part of that knowing that we're changing, okay? We have grown so significantly, right? It's like during COVID, you showed up at a restaurant and you're like, I want to be seated like I've always been seated in 10 minutes, 20 minutes, 30 minutes. And what happened? You never got seated. And you just left and went somewhere else. Unfortunately, we're moving back towards that with the growth that we're having and the inability to fill roles and responsibilities. And what's worse is the community, in most cases, has longer wait times. And so it's not just Atlanta, my medical center, it's everywhere around us. So my commitment is to continue to do better at what we're doing right now, right? And let you know that we no longer accept mediocre, right? It's completely unacceptable to come to work and be like, I'm gonna do the exact same thing I did yesterday. No, I need you to do one more thing than you did yesterday, right? The other thing I'll say is, I have heard that a lot. I've heard that a lot about the Atlanta VA healthcare system. I heard that before I chose to come here, where I could have stayed in Jackson, Mississippi, enjoyed my family, my friends, my community, but I heard it so much about Atlanta that I said, if I don't go to fix it, who will? Right? And what I've discovered in the year that I've been here is that it's not entirely broken. There's a room full of people in here that want it to be better and are working towards it being better. And frankly, most of us just struggle with communicating what our problems are and getting the support to fix it. And then once we figure out how to communicate what those problems are and we start fixing it, it's contagious for us. But it's you telling us these things. This is why my service chiefs are in the room. Is so that on Monday when I meet with every single one of them, I don't have to be, well, one of the veterans said this. They heard it first person. So I really appreciate you bringing that up. Yeah, thanks.
A quick question in the chat. It's a simple one. Why doesn't the Atlanta VA have a blood drive? So we had them at other sites. They want to know why we're not having one here.
Why don't we have a blood drive? I don't know. We should. I was thinking about this the other day, too, when I was running on the treadmill. I'm like, I can't believe I haven't donated blood in a while. We should have a blood drive and a bus here. Yeah. Go ahead, ma'am.
So first I want to say I've been coming to town halls for the last gazillion years, it feels like, and I've seen directors come and directors go, and out of all of them, I feel the most comfortable and even safe having met you and listened to you and your care and concern that you show towards the Atlanta VA. And I like what you said about being who you are and responsible for those in leadership, and that's your job, and I appreciate that. I come just because I didn't even know you all had a chiropractor until like 5 years ago, you know, and I didn't know that there was other service, well, actually more like 7 or 8 years ago. But it is very informative to hear the things, like you said about the eye clinic, like not knowing that you have the visual things, or even that you're supposed to get cleanings twice a year and not able to because there's no hygienist. And so I do appreciate that. And I do know that there's other VAs around the country that could be better, but it's only as much better, as good as we make it, you know, and you know, there's grace that has to be given and a degree of appreciation for what we have. You know, we did serve, but these people are serving us, and I love the fact that they always say thank you for your service after they treat us. So I do want to start with that. And there are things that are broken, and there is things that I have to push through. So my doctor, my primary care physician in the women's clinic, she left. I've known her for 7 years, and we had an amazing relationship. And it's just been a challenge trying to navigate back into finding out. And it's not like them where I don't have anybody. I was assigned somebody. But it's just been this breakdown in communication and being able to being seen. And I thought that there was this turnaround on Healthy Vet, and I've been on it since the day I came here 9 years ago. And I'm very communicative to the point where people are like, oh my God, your list is long. And I'm like, you told me to talk to you. And so, but I don't get responses, and that's never happened before.
So it's provider driven, but we're working on it. Every day we look at my Healthy Vet coordinators in the room. In fact, I poked Fundraider this morning because the rate of non-response has gone from 7 to 8 today. And so we're like, you know, what's going on? You know, why is this happening? So we do look every day. I do the same thing. I use my Healthy Vet to talk to my provider here it's very helpful to know both sides, knowing that they're responding, not responding, the escalation rate. And also as a patient, like, man, I emailed 2 days ago, and I don't use my position to throw it around with the providers. I prefer they don't know who I am, so I know what you're going through. Yeah, see, a month is excruciatingly long, so it shouldn't be. Yeah, and so we'll work on that. Absolutely. To me, that's one of the biggest access points. I have a new deputy director who's acting in a role, and she said, if we can get people to respond on My Healthy Vet, that'll help improve the trust, which is exactly true. And I appreciate your comments. You know, we do care, and we do want to fix it. We do have bad apples, and we are working through those bad apples. And if you didn't come to this, and it's funny you say chiropractic care, if you don't come to this and share with us, then I don't have as many avenues to hear and improve upon, right? There's a lot of things we work on, but you bringing your perspective helps us. I'm trying to get chiropractic care, and they made me go through the whole health services. It's like 90 minutes. I'm like, oh, this is nuts. Why am I going to go? Okay.
Hey, sir, just a heads up. We got a suggestion that we take the veteran town hall on the road, so consider taking it to some of the C-box if they have space.
So we're going to do it, let me text my wife. We're going to do it on Saturdays, and then we're going to be driving all over the state. So I'll do as much as I can, right? I'm going to do as much as I can.
Hi, my name is Bob, and I am a Vietnam vet, 73 today. But
Bob's 73 today. Happy birthday.
So I came into this building about 50 years ago. So I've seen a lot of changes. And I'll give you accolades that this place has improved every year, over every year. So that's really good. I didn't start using the services until I retired, though, for the VA. I always had private insurance that took care of me. One of the things I've noticed, and this is a suggestion, is I use a kind of a team care concept. And I also have a good science background, so I kind of look over my doc's shoulders. And so right now I have a PharmD. I have a primary who's the CMO over at West Cobb. I have a nurse practitioner assigned to me in hematology, and I have the MD, the director over hematology, and I have a pathologist that works with me on one of the procedures. So the problem I'm running into, though, is they all live within their little fiefdoms, and they don't confer with each other. So sometimes we have a conflict in how you're handling your meds, and I end up being the glue. So I use secured messaging to each of the docs to update them. And it's a lot of work to do that. And it just seems to me that, I think your problem, and I come out of management, I think the problem is that they defer rather than confer with each other. And so they're deferring this many times between each other and just afraid to get out of their sandbox.
I like that. Okay. Obviously, I don't know this solution because it's a bigger problem. Right, this is huge, but I love confer. Yeah.
I'll be happy to sit down with you one day, give you more details.
Okay, thanks. I appreciate that. I like that. That's neat. Excuse me. No, you're okay.
I wanted to know, are there any plans to relocate the Bronze Clinic from the 11th floor to the first floor? Because that clinic services veterans with mobility issues, such as myself. So if there was an emergency, how are we to?
If there's any, let me repeat the question for the room. If there's any plan, and I don't know, so maybe somebody does. If there's any plans to relocate the Bronze Clinic from the 11th floor downstairs because of the if there's mobility issues, how does that make any sense? Minley. Not to put you on the spot. Chief Minley's here, our chief engineer. Is it a primary care? I'm not familiar with what it is. It's primary care. Dr. Papadusa. Our chief of primary care is here. Acting chief. Is there any plan? Do you know if there's any plans to relocate? It's not primary care. Oh, it's geriatrics and extended care from the 11th floor to the bottom down. I don't know, Mr. Minley. Is there? No.
Not at this moment.
So I'm going to have to look into then what the mobility challenges are. And yeah. I'll tell you this. I just got word this morning, and even my team doesn't know this. I just got word this morning that we were treated special by central office to conduct a survey of our facility and the outlying clinics for the possibility of building a new hospital. Yeah, we just got that this morning, and you guys are hearing it first. It's a national survey that a lot of hospitals were going to be included in, and we jumped up and down and said, please just make us separate, make us special. And so they're going to do that. It was just awarded to a contractor, so now they're going to start spending some time with us to decide, what that looks like. I mean, this building is owned by the federal government, so it's very unlikely that we ever get rid of this. But what does it look like outside of us? Having just moved here, it's extremely busy, it's extremely congested. It's very difficult to get around, as our Saturday comment was. And with everybody returning back to the office, it's even harder on the roads, right? I mean, all of us are going to be seeing each other in traffic on the way home tonight. So it'd be great if they recommended, instead of having primary care here in this building, maybe go somewhere else, with a pharmacy, with those ancillary services. Sean Harrison, my strategic planner, says yes, there is plans. Okay, there you go. Thanks for asking continually, sir. Working my way back. I know there's one. Oh, go ahead.
I got in late. Had a ways to travel, so if I ask this question, somebody probably asked it already, but to preface it, it took about 10 months to get my chiropractic services started, and it took almost a year to get the acupuncture started, right? So my question, I just want to ask from the top, what's the procedures, if you can tell me from the top, because I get so many different answers, right? What are the procedures for the community care process? And then after that, how is it enforced? Because I'm waiting right now, since January, for urology, right? They say, well, we can get you in April.
I got it.
They
Here,
say,
I'll answer your question.
This is another one. They said, I'll get you in April. I said, April? I said, that's 3 months from now. I thought it was 30 days. She said, okay, well, I'll call you back. Haven't heard nothing yet.
All right,
This
I
is
got you.
March. But communication, I haven't heard anything back yet, though.
So here's the process. As a patient, and I'm going through this is chiropractic care. As a patient, when you ask for services, chiropractic care, whole health services, you're expected to go through a whole health coaching to teach you about chiropractic. You did that. I just did mine yesterday. So after that, you have to tell your provider, hey, I need a chiropractic appointment. The provider puts in the consult. It's supposed to go to, we have a new associate director for access, oversees our scheduling team and our community care team. It's supposed to go through a process where the nurses look at it and say, okay, this is appropriate. This veteran needs this care. That happens very quickly, 1.24 days for us. And then they tell community care, it's supposed to. I use the word supposed to, sir. Once that happens, they're supposed to give you a call, right? And if they don't give you a call, what happens is exactly what you're doing. Hey, no one's called me. I need to get my care. You know what's amazing to me? This is a big deal. Here's what's amazing to me. My wife's not a veteran. Do you know how she gets a chiropractic appointment in the community? She picks up the telephone. So we've changed that. What surprises me the most is that I'm a veteran and we do everything for you. And we still have a 20% no-show rate at our appointments. 20%. So what happens? Yeah. So what happens when that patient doesn't come? We try and scramble to get someone else. So we spend hours on the telephone to try and get somebody else to come in for that appointment when they could be answering the telephone and scheduling your appointment in the community. Right? It just blows my mind. One, we have a system that's called veteran self-scheduling. Do you know how many appointments are? Yes. Do you know how many appointments are scheduled? It's like 20 appointments a week that me and you and us veterans schedule ourselves. That's it. Do you know how many appointments are scheduled a week in the private sector? All of them. Right? So we can take your information. We can get very specific with you. That's why we have community care in here. We have our HAS leadership in here, and we'll follow up. It's completely unacceptable that it takes 10 months. But at the end of the day, it's on both of us. And if we're not answering the telephone, then do exactly what you're doing. Come up in here and tell me so that we can figure it out. We've got brand new telephone numbers and brand new extensions on this piece of paper. It's called Save a Trip. Okay, we've got it on our website. We're sending it out for Gov Delivery if you've got emails with us, and we're trying to make it accessible to every single clinic. It's a piece of paper per clinic, because every clinic is different and has different extensions, different telephone numbers. What I've discovered is people are calling telephone numbers they got from 10 years ago. Right? And I don't, not very many people have the same phone number from 10 years ago in their pocket right now. Right? Okay. Someone had there's 3 in a row here. Go ahead.
I was stationed in Fort McClellan, Alabama, and I know that's not in the spotlight for anybody like Camp Lejeune, but I have been exposed to CS gas, mustard gas, equipment fumes, and smoke grenades. And I know there are some issues that I'm dealing with from those. And I also know that I'm concerned about the long-term effects. But yet I have no doctor to talk to. My primary, I talked to her about it. It's like I don't have that type of knowledge. So who can I talk to as far as issues that I may have, issues that will happen, and anything that is concerned with the toxic issues that I have back from my time in service?
I got my chief of social work in the room. I'm looking right at her. She said she's got it. She'll let us know what to do. Yeah. Right here in the blue shirt, pink mask. Thanks.
Oh, is it me? It's a pleasure to meet you, first of all. Is Mentor or Mentor?
Mentor, like you
Mentor.
say, sir.
Okay, well, I want you as a Mentor because I spoke to Mr. Kemp, the governor, about getting a veteran in this hospital. My thing is that we used to have a board of advocacy for the veterans.
Yes.
And some of these issues, many of these issues here can be handled on a monthly basis talking to you or your assistant director. Matter of fact, I gave your assistant director my phone number a month and a half ago. Okay. I went up to your 3rd floor 3, 4, 5 months ago to try to get to you right after you got here. It's the first time I've seen the picture out there along with, what's his name, Mr. Trump. I can speak better than him without a prompter. I want the patient advocate, please. We would like to have our patient advocate board back.
You got it.
And Brown, thank y'all. These people
You got it. Yeah. So here's what he said. He said he wants his patient advocate board back. Yeah, the patient advisory board. We got that. Done.
Once a month, either you or your assistant director, or you can get
Yep.
here. But if we identify a problem, we had Miss Walker here. We didn't even have the push buttons to get in and out of the bathroom. If you want to know what it's like to be in a wheelchair, get in one and ride around here for a day. Okay, I'm not saying you do that because you're the chief. But when we have a problem, we need to, and I'm talking about these veterans' problem. This lady right here, what's your name? Oh, I can't forget your name. Yeah, she's my mental health mentor, or whatever you want to call her. Fine people in this hospital. You had one bad apple here in 93, and he put me in this wheelchair. I'm about 420, never mind.
I'm pretty sure he was going to say 424 years old.
I'm a chapter. You know what a Chapter 1151 is? Let me educate you. It's a tort claim against this hospital. Okay. But, I was already 160% from Vietnam. Hello? My wife was from North Vietnam. She died of Agent Orange.
We will get that patient advocate group together. Somebody got his name? They got his name. Okay. Half my team's got your name. Thank you, sir.
Oh, I dropped my voice.
I got you. We got one. Please.
Hi, my name is Calvin. I was injured, don't mean to be the bearer of bad news, but I was injured stateside in the 70s. And they couldn't believe that all of the things that had happened to me were going on. And right now, I'm trying to get a 1134 or 1135 Lexus letter that is mandatory by the VA to give me an examination for all of the things that happened to me. I'm rated right now about 50% disabled. as it stands right now, and I need to have the Lexus.
1135 form? 1134? Nexus? 1134 Nexus? They won't do it? They won't do it from primary care. Maybe we can have Dr. Papadusa help.
I had to go outside to get my Nexus letters, so he might have to look at a physician.
Yeah, that's very
on the
specific. We'll
outside.
follow up with you. Did you say VBA?
They sent me to a doctor, but they didn't send me for the service.
They sent you to the doctor, but not the Nexus. All right, we'll follow up with that one. Go ahead. Sorry, sir.
Yeah, sorry, not a very public speaker, but I was deployed twice to Iraq, and I was my second deployment. I was a Bradley driver, and Bradley driver and gunner, and I was exposed to like a lot of chemicals, like physically. You know, there was a training session where I had like my skin like peeling off my hands. You know, while I was in a training set, where I was in a training area in Fort Stewart. Time went on, got checked up, but for some reason it didn't get put in the file. It didn't get listed as a concern, because like during that time we were always focused on deployments. And eventually it went away, but now I'm having like some kind of consequences with my hands. You know, like they're always like dry, peeling. Always have to moisturize them. And I went to dermatology and talked to them about filing for a PACT Act, and I did. I got denied because there was like not a lot of information. And I was told from a doctor, they were like, if there's no information for that experience, we can't do anything about it. So I'm just like, things like, I just turned 37 like last November, and I know like kind of as you age, the immune system kind of changes and stuff like that. Because like, it's concern for me and everything, so I'm looking this stuff up. So I don't know what if this continues and everything like that. I still want to be able to use my hands at some point in the future. But they're always peeling. I'm afraid of an infection sometimes. I gotta wear gloves all the time. And I'm getting mixed opinions from doctors. Gloves on, gloves off. Same medication. Went there last week, and they were like, hey, here's the same medication. We'll see in a month.
I'll tell you the same thing I tell every patient that brings up, every veteran, every colleague that brings this up, file again, and again, and again, and again. And when you sit down with my providers, ask them to please note this in your clinical record, right? When they ask you what's going on, don't lie to them, right? Stop lying to them. Start telling the truth. Well, yesterday I took my gloves off, my hands were sweaty, and something slipped, right? Just I don't want to get into coaching and mentoring on this stuff as a patient, but I'll talk to you offline. Okay.
Team Atlanta, I know we have a lot of staff on the call. Your attention and care is appreciated. Please do not share internal links with veterans. I have folks on my team who are in the chat. They will share what needs to be shared that is available externally. Next, please do not engage anyone who is disrupting the meeting. Let them be. Do not engage. Thank you.
Thanks. Hey. Our new chief of dentistry is here. She just joined us last week or so. I just happened to sit down next to her. We're super excited to have her because our dental access is not so good. I know it's even worse in the community, but ours is not so good. And we're just super happy to have her because there's some efficiencies that we can be doing. There's some hiring we need to do. There's some additional work we can do. So I'm just, great to have you. Thanks.
Okay, I won't take the mic. Okay, I'm glad you're here. The last town hall I went to was you were on board, but you weren't here yet. So I know a lot of people talked about My Healthy Vet. I don't know if Miss Cherie Willis. Okay, she was my lifesaver last week.
That's her right there in the
I have been working to get on My Healthy Vet. I'm an avid user of it until they changed over January 25th. I tried everything up until I talked to her. But before I even talked to her, I was sent to this clinic, Arcade. I was sent around wasting gas trying to find a team to help me get on. And I specialize in computers and could not get on. It took her. I waited patiently. The front desk said, let me take your name and your information. It was about 5 days before she got to me because I know she has other customers. But you all were talking about My Healthy Vet. That's if you can get on My Healthy Vet. So in the meantime, my doctors have put in new prescriptions because I can't get on to reorder refills. That's wasting time. Yes. Okay? And so I go to the window. If you notice, the veterans, the pharmacy line has gotten extremely long because you can't get on My Healthy Vet.
We had 20 pharmacists in the pipeline to hire.
It's the key word.
It's been one of my pressure points with our chief of pharmacy here, Dr. Denner, because it is embarrassing.
I literally have been driving for 2 weeks to VA to get stuff done because I can't get on My Healthy Vet. But I can get on there now. Thank you, Cherie.
Cherie, what was the issue? But what can you tell the other patients maybe that are in the room or online that want to know? Like, what was the fix so that if there's another...
Yeah, so there's two login partners that we use now. They're more secure for the veterans, so you can no longer sign in with your My Healthy Vet username or password. You'll have to use login.gov or ID.me, and you'll have to self-verify. We can no longer verify at the medical center anymore, so you'll have to upload pictures of your driver's license front and back. And if you run into issues with that, you'll have to go to your nearest participating post office, and they can verify you there.
So the veteran telling me that the issue was the driver's license verifying your ID portion, which has been cumbersome.
Take the picture, and it tells you it doesn't recognize the picture. But we got through that. But one thing I also found out.
Are you who you say you are?
Yeah, I had to pinch myself several times. But the other thing was I found out if you deal with Social Security, guess what you need? Login ID and ID.me. So there's a benefit of getting it done for your My Healthy Vet, because after that, all you have to do is go in and do SSA. So you've met the requirement for other federal organizations, so it's a benefit, and I found that out last week.
Thank you.
Okay, the other thing was community care. I couldn't communicate with them to tell them my problem because I didn't have My Healthy Vet to kind of elevate. But I went to, I had a mental issue breakdown because I am a cancer patient and I have not been able to make my appointments because I do not have my community care approval, and it's been sitting there since February. Now imagine having to go and have labs work done as a cancer patient. Already missed 2 appointments because I'm not going to, it's on the outside at Emory. I'm not going because I can't afford to pay the bill. If I show up without an authorization, I have to pay the bill. There are 3 consults pending in community care. I went to patient advocacy. They've been working with me. And till this date, I don't have my authorization for physical therapy and 2 chemo oncology appointments.
Ms. Booker, we can get that taken care of? Perfect. The other thing, thank you. We'll get that taken care of. I feel the emotion in your voice, and I appreciate it. I do. Yeah, some folks online wanted me to ask about dental and see if you wanted to speak a little bit about dental. And share a little bit about dental. So before we do that, Ms. Booker asked something. Oh, we're bringing on. So here's a unique fact about dental. I talked about eyes. I'm learning a lot of stuff. The dental arena in the VA. So I get my care for dental in the community, right? And every 6 months I go for a cleaning. Right? It's the standard in the community. That's just the way they do it. What's weird is that may or may not be the standard in the VA. There you go. It's really unusual because there's so many patients that need dental in the VA, and the VA is not resourced to do that care. And what happened was the toxic exposure and the PACT Act increased so many patients to 100%, and now you're eligible for dental right? But what we're seeing is we're sending more patients to the community for that. So what we are doing is we are hiring a dentist to work in our community care department, right, to assist with the expertise that's required to be able to have that conversation with our patients that may or may not need to go out to community care. So I'll turn it over to our chief of dental.
Hello, hope everyone's doing okay. A little bit about dental and being eligible. As you may or may not know, to be eligible for dental at the VA, you have to be, for class 4, 100%. Class 1, if you have some type of TMJ, jaw, it has to be greater than 10%. You can come through other domiciliary programs. Homeless programs is what they call, and that is a class 2B, which has limited eligibility. There are tons of eligibility categories, so it becomes very complicated to a certain extent. When you receive care as a 100% patient at the VA, that means that we can provide you with all of your care you need, whether or not we can provide it here or we have to send you to the community for some of it. I am very new here. I am maybe day 10, but came from another VA as well. So I'm here because I want to be here and help everyone here in Atlanta. Thank you. I came from New Orleans, Louisiana. So part of what we have to do, I was actually just looking at the numbers. In Atlanta, we have 46,000 veterans that are eligible for dental. I have 19 dentists. I have 5 sites. My largest site has 25 chairs. That tells you about the capacity of which we can see patients. We are just limited. We are stretched to the limits. And I have people that work every day, at least 12 hours a day, trying to respond to everybody. We're stretched to the max. Are there things that we can do better? Absolutely. Are there things we will do better? Absolutely. But we're here to serve you. I love serving veterans. I love what I do. I love talking to them every day. And so I hope that we can make an impact and just have a better overall experience for you.
Thank you. Yeah, thanks for doing that on day 10. Go ahead, sir.
All right, just a little piggyback on the dental. For those that are not qualified for the dental, those that are not qualified for the dental but are still looking for dental insurance. We know insurance is very, very expensive. VADIP, that is the VA Dental Insurance Program. All right, look it up. It's served by 2 insurance companies. Humana is one of them, and the other is United Concordia. Both of them have excellent dental programs, and you can get your dental care taken care of at a cheaper rate than trying to find some other OHI, other health insurance.
Thank you, sir. So I know we've got some additional questions, but what I'd like to do is wrap it up. Here's why. A lot of folks in this room are still seeing patients this afternoon. And so I want to provide them that opportunity to go see that patient while we're in here. But before we go, I got to say thank you so much. Thank you for the presenters to coming in. Thank you for our VBA staffs. Thank you for our frequent flyers that have been here before and I get to hang out with. Thank you for being honest and receptive and allowing us the opportunity to fix these challenges, bring the challenges up. Use specifics if you're going to go around to the table so that we can fix your issue. And then as we learn from the lady in the back of the room, you know, there's a lot of things that are happening to us as patients that if we can speak up about it, then we can share it with 300 people on the teams, right? And roughly, 50, 75 people in the room so that maybe it won't become an issue for them. All right. Thank you guys for coming in. Thanks for trusting us with your care, and I'll see you next quarter on a Saturday or in a clinic somewhere.